Hi, my name is Heather Clark. I'm the Nursing Lab Coordinator for the BCIT School of Health Sciences Nursing Lab. This is a low fidelity experiential skills lab, and I'm going to show you around. So behind you we have one of our main labs. Now everything will look a little bit different right now because of COVID. Normally we'll have 6 beds in here and we'll work with 2 students per bed. Right now we have it all divided up for safe distancing and we'll have 1 student per bed. You'll also notice everything is stripped down to the bare minimums, and that's for a safety protocol. But I have brought some stuff out to show you. This lab mirrors that lab, so we can do the exact same things in both labs. Normally we would have 1 instructor and 8 students in this room with a 1:8 ratio. With the COVID, we'll now have 4 students in this room and 4 students in that room. And what happens is the instructor then can work with both. See everything that's going on with the students. We can also use technology, computer, or Elmo, which is this screen at the front of the room that we can closely show different pieces of equipment so students can use it. Just so you can see, we do have a lot of different equipment in our lab. Other than the mannequins, we have different kinds of anatomical, visual things for students to look at. We also have, as much as we can, we try and mimic what is in our health authorities, whether that be different kinds of pumps or different kinds of equipment that the students might see. The other thing that we do for our students, and we've ramped it up during COVID, is we provide students with their own equipment and supplies that they can take home and also bring back into the nursing lab. We call them goodie bags. So they're things that they can actually take home practice with. Dressings, that's a catheter set, or we have injection things as well. They also get their own bag to carry it around with. So as much as possible, we try and ensure this looks like a hospital ward or bed. We try and keep up to date with, again, what's in the hospital, glucometers. The students also can have their own supplies to take home. That's for taking out stitches and sutures. And this is our basic lab. I'm going to take you through our prep area right now, which is where we set up and take down and have all our extra supplies. Come on by. Hi, welcome to the Open Lab. This is an area where students can come in and practice anytime they want during the week. It's normally a drop-in, and we'll provide all the supplies that they need. During COVID, unfortunately, we've had to have them book appointments. And again, this is exactly like the teaching lab. All the equipment and supplies are the same, and students can socially distance and still work together and practice whatever skill they want in all our different levels.
Welcome to the simulation lab. Right now, you may notice that our setup is modified due to COVID restrictions. We currently have 4 stations that are outlined for physical distancing requirements. Previously, we had 8 bedsides with mannequins that students could work at. This is our booth with one-way glass where we are able to observe students and have headsets for the simulated patients. We have 8 nursing and mannequins that the students assess and interact with. They have lifelike skin, chests that rise and fall to simulate breathing. They blink and have 10 pulse points. They also cough, moan, vomit, have short of breath breathing, and respond yes or no to questions.
Yes. No.
Students are able to assess all vital signs, and the monitors display O2 saturation, temperature, and heart rhythms. Our BSN program integrates simulation into every term, both clinical and theory courses. Our scenarios involve hands-on experiential learning and incorporate decision-making and critical thinking. All of our simulations include a pre-brief and debrief. Thank you for visiting our lab, and let us know if you have any questions.